Now let's learn how to give CPR to an infant under 1 year of age. Remember, CPR combines repeating cycles of chest compressions and rescue breaths. We'll practice those skills separately before putting them together to do CPR. You will need an infant mannequin and an infant CPR mask to practice. Be sure to get those before moving on to the next segment. Welcome back. We're going to practice doing chest compressions. Position yourself near the chest of the mannequin. You'll be using 2 fingers to do the compressions on an infant. Slide your fingers alongside the nipple line to the center of the chest. You'll push straight down with the tips of your fingers. Ready? Let's push with the beat. Here we go. Push hard, at least 1/3 the depth of the chest, or about 1.5 inches. Push fast, at least 100 times a minute. You're doing great. Now let's do a set of 30 compressions from the start. Do them with me. Are you ready? Find your finger position. Let's start. "25, 26, 27, 28, 29, 30. Great. If you need more practice with compressions, this section can be played over again. Now let's practice giving rescue breaths. Kneel near the head of your mannequin. Look at your CPR mask to make sure the one-way valve is inserted and is the correct size. Place the mask over the nose and mouth. Put your thumb and forefinger around the top of the mask and press lightly on the mask. Hook the bony ridge of the jaw with your fingers of the other hand and use your thumb on the bottom of the mask. Tilt the head and lift the chin to open the airway. This also brings the face up into the mask, which helps to create an airtight seal. Take a breath and blow through the valve opening. Each breath should take about 1 second in length and create a visible rise of the chest. No more than that, okay? Now let's practice giving 2 breaths at a time. Be sure to come up off the mouthpiece and take a fresh breath in between them. Ready? Do it with me. Let's try it again. You're doing great. Let's do a series of 2 breath sets. If you're still having problems getting chest rise, work on adjusting the airway or the seal of the mask. You can also ask your instructor for help. Ready? Here we go. Try not to overventilate. Be consistent. Excellent. One more set. Nicely done. If you need more practice, this section can be played over again. Are you ready to put it all together and perform infant CPR? Great. First, let's go over the steps of assessing an infant to see if she needs CPR. Before assessing, always make sure it is safe for you to approach. If an infant appears unresponsive, tap her foot and yell loudly to startle her. "Are you okay? Are you okay?" If the infant is unresponsive, assess for breathing by quickly looking at the face and chest. If the infant is not breathing or just gasping, have another person activate EMS and get an AED. Activate EMS and bring an AED. Then check for a brachial pulse on the inside of the upper arm. If no obvious pulse is found within 10 seconds, you need to do CPR. Let's try the assessment steps together. Are you ready? Are you okay? Are you okay? Activate EMS and bring an AED. She's not breathing and has no obvious pulse. CPR is the appropriate care for her until an AED or more advanced help arrives. Let's put it all together now. First, we'll see if CPR is needed, and then we'll provide 2 minutes of compressions and breaths. That's 5 cycles of 30 compressions and 2 breaths. If you get tired, it's okay. Take a break. This section can be played over again. Are you ready? Here we go. Are you okay? Are you okay? Activate EMS and bring an AED. Congratulations, you just finished practicing how to perform CPR on an infant.